Welcome to The Explainer. Today, we're pulling back the curtain on the science behind your prescription. We're going to get into the crucial and maybe a little overlooked idea that really determines exactly how much medicine you need to get better. So let's start with a question that honestly affects pretty much all of us at some point. You get a prescription, but how did your doctor land on that specific dose? Is it just some standard amount, or is there something way more personalized happening that accounts for how your body works? Now, you've probably heard about a drug's half-life, and look, it's definitely part of the picture. But for the doctors and clinicians making the decisions, the real key, the most important number they need to know, is something called clearance. It's all about your body's personal cleaning efficiency. And hey, don't just take my word for it. The source material for this explainer puts it in black and white. Clearance isn't just a big deal. It is the most important PK parameter. That's just a fancy term, pharmacokinetic, for how drugs move through the body. It's the key to making sure a drug is both safe and actually works for you. Okay, so let's get into it. To really understand clearance, let's use a little analogy. Imagine your body is a bustling city, and a drug is, well, something that needs to be cleaned up and removed.
So the technical definition is this. Clearance is the volume of fluid, we're talking about your blood here, that gets completely scrubbed clean of a drug in a certain amount of time. And you can see the units there. It's all about volume over time, like liters per hour. And this, right here, is the most important distinction. Clearance isn't about how much drug gets removed. It's about the efficiency of the removal process. So, going back to our metaphor, we're not measuring the cleaning crew by how many trash bags they fill. We're measuring them by how many city blocks they can get totally spotless every single hour.
Let's make it real with an example from our source material, penicillin. For a typical person, the clearance rate is about 15 milliliters per minute. So what does that really mean? It means every single minute that goes by, your body is able to take a 15 milliliter chunk of your blood and make it 100% penicillin free. Okay, so if this cleaning efficiency number is so incredibly important, how on earth do scientists actually measure it? How do they get that efficiency report card for a specific drug in your body?
Well, it turns out scientists have a few different ways to tackle this. They can build these really complex models based on blood flow to your organs, or even treat the body like a series of interconnected water tanks. But we're going to focus on the most direct method.
We're going to zero in on that last one, the non-compartmental approach, because it's the most straightforward. Basically, scientists give a patient a single dose of a drug, and then they just track how the concentration in the blood goes up and then back down over time. All of that exposure from start to finish is a value they call the area under the curve, or AUC. And this leads to some pretty simple, beautiful math. You just take the total dose that was given, and you divide it by that total exposure, the AUC. And bam, the number you get is that critical clearance value. It's a perfect link between the pill you take and how your body actually processes it. All right, so we know what clearance is and how it's measured. Now let's go see where all the action happens. Now, the liver is also a major player here, but the main headquarters for filtering drugs and waste out of your blood, that's the kidneys. And if we zoom way, way in, we find the real stars of the show, these incredible microscopic filters called nephrons. Our source material points out that each of your kidneys has over 1 million of these things all working together 24/7 to clean your blood. So the cleaning process inside every one of those million nephrons happens in 3 main stages. First up is filtration, which is kind of like a big sieve that lets small drug molecules get pushed out of the blood. Then you have active secretion, where special pumps actually grab drug molecules and shove them into what will become urine. And last, there's reabsorption, a recycling step where your body can actually pull some of that drug right back in. And each of these steps is its own unique thing. Filtration is passive. It just relies on your blood pressure. But secretion, that's an active process. It burns energy, and it can even get maxed out if there's too much drug at once. And reabsorption, that can be affected by things as simple as the pH of your urine, which can change depending on what you eat. Okay, deep breath. We've been deep in the science of the kidney. Let's pull all the way back up and tie this all back to that very first question about your prescription. Why does all this talk about your personal cleaning efficiency actually matter? Well, it all comes down to this one simple but really powerful equation. To figure out the right dose, your doctor multiplies your body's unique clearance, that's the CL, by the target drug exposure, the AUC, that they know is needed to get the job done. And this is the real magic of personalized medicine. A doctor knows the target exposure they need to hit for a drug to work. So, by understanding your body's specific clearance rate, they can calculate the exact dose to get you right into that sweet spot. Not too much and not too little. And that leaves us with one last thing to think about: your body's clearance rate. It's not set in stone. It can change as you get older, it can change with your health, it can even change with your weight, which means the perfect dose for you today might not be the perfect dose 10 years from now. It's a great reminder that medicine isn't just a static number. It's a dynamic thing that has to adapt right along with us.